The Department of Health is launching an organ donation awareness campaign today out in Boksburg in Gauteng in order to promote organ as well as tissue donation here in South Africa. The department says with around 3,000 patients on the waiting list, the campaign then encourages families to embrace the gift of life as many die whilst waiting for transplants. Now, the initiative aims to highlight the life-saving role of organ and tissue donation. Let's now welcome Janette Thompson, the Deputy Director General for Primary Health Care at the Department of Health, National Health Department, alongside Professor David Thomson, who's a transplant specialist and a critical care surgeon at UCT and Groote Schuur Hospital. Prof. Jeanette, it's great to have you with us. Thank you so much for your time. Welcome. So, Jeanette, I'll start with you to basically briefly tell us about this great and absolutely essential awareness campaign by the department, especially looking at the fact that there's so much misinformation or lack thereof when talking about organ donation in the country.
Alicia, thank you for making time. Thank you to you and SABC News for making time, and so that more viewers can become aware of the situation. So we really need South Africans to register to become donors. You know, when the time comes that we don't need our organs anymore, that's the time of our death, unfortunately. Because there are many South Africans whose lives could be improved and saved through the gift of organs from others. We are told by the specialists that one person who donates their body, their organs, can save up to 7 lives. Now, Prof. Thomson, David, knows the statistics much better than us in terms of the people who are on the waiting list. You know, where South Africa ranks in the world in terms of citizens having registered to become donors, and we really want to increase that number. But as the Department of Health, Alicia, we're also asking healthy South Africans to look after themselves, to make sure they stay healthy and they don't have develop non-communicable diseases that would put them in a condition to need organs. And so we want to make South Africans aware of the noble cause of, you know, registering and for science to be able to use your organs when you pass on to help others.
Mm-hmm. All right, thank you so much there, Jeanette. So, Professor Thomson, welcome as well. I mean, what an honor. Look, I speak for many, I suppose, when I say this industry is almost just getting by quietly and assisting so many people, though, in need of life-saving organs as well as tissues via the donor system. But let's talk about our current as well as available options, Professor, for both potential donors and those that are seeking organ transplants there. Jeanette says you have the numbers in terms of stats of the waiting list of citizens in the country, as well as those that are actually registered in the country's registry for donors.
Yeah, it's a privilege to work in this space. Thank you, Alicia, and thank you to the Department of Health for prioritizing this as a message we need to get out there. It's almost a public health imperative that we empower people at the end of life to be having those conversations about the option to help others. And the numbers are, you know, staggering in terms of what we could do, because on average, 4 organs for a deceased donor and multiple tissues. You can help 2 blind people see. And that doesn't require an emotional situation in an ICU, which is always really difficult in counseling families and taking them through that process. So in South Africa, we get around 1 donor per million population each year. And other countries are performing much higher than that. Brazil would get about 16 donors per million population. So we've got an opportunity to do a lot better as a health system. And registering is a good thing, but it really depends on you speaking to your family, because we'll always be engaging with a grieving family at end of life. And if they don't support it, we don't proceed. So we have to have permission from the next of kin to proceed. And that's a message we need to get out there, because we need to be having this as a conversation as a society, that we have this gift. And us as healthcare professionals, we need to offer it to the family. And it's always hard. These preceding stories are so emotional that we've just been listening to on the news. And can you imagine the healthcare team speaking to the family at that time and needing to do that with the compassion in order to let the family get to that point of acceptance, and then thinking about what next, how do we go forward, and being able to offer them the solace of organ and tissue donation, I think is a gift that we as healthcare workers can offer many families. And the benefits are huge to the healthcare system. But as Jeanette says, prevention is better than cure. And while transplant will turn something around from a really tragic end organ failure that is giving people horrible life with lots of disability, a transplant can truly turn that around. So I'm really proud of our department. The logo is amazing. It really brings us together as a society, and it's something we have to do collectively. We can't do it in isolation as a silo.
Absolutely, Professor. I mean, Janette, talking about the Prof's benefits there, how is then the department through this initiative going to address some of these misconceptions as well as myths to also encourage potential donors? And maybe just how far-reaching will this campaign go, Jeanette? We know that South Africa still has very largely underserviced areas where people are not even aware of these available options and end up suffering alone. As I stated in my intro, about 3,000 people actually dying or sitting on that donors waiting list, suffering alone. And most importantly, will you then be able to directly identify such individuals and accord them the necessary assistance, be it your recommendations to specialists like Professor Thomson to their areas, for example?
Alicia, you were so spot on when you said just now, this is an area that seems to just have quietly gone by their business and doing excellent work. So we sat in a meeting with the specialists across the country yesterday for the day from 8 to 4:30. And in the evening, we had a function where we listened to actual living donors and to actual recipients. And let me tell you, let me go back to the day's function, listening to presentations by the specialists. I myself, as an administrator, learned so much about this program. And it made me realize, how important it's going to be for the department to support this area much more than what we've done in the past. So we've listened to them yesterday. There's recommendations out of that meeting that points to the changes we should make in the health system to be much more responsive, to be able to make it easier for people to register and donate when they can, and also for the people in need of organs to be able to get those organs transferred and for them to get well and carry on with their lives. Now, you were asking about the misconceptions. Listening to many of these specialists, and they work in universities, but they work in hospitals as well. When you listen to them, you can hear these are professionals who practically work with patients and patients' families. And I've actually learned so much about the methods that they apply in counseling parents, of someone who's perhaps brain dead and whose life cannot be saved, but the type of counseling techniques they apply to such families to make them consider and maybe ultimately agree to donate organs. And the stories, when you listen to how the testimonials of people whose lives have been improved through receiving organs, and also the families of those who had given organs, to say it actually makes them feel so good and proud to think that their relative has in a great way assisted to make someone else's life better.
Thank you so much, Jeanette. And Professor Thomson, let's talk about the fundamentals then of organ donation. What are the rules for organ donation here in South Africa, from registration to cost to age, ethnicity, the donors list, and who actually can utilize these services? Because we saw, I'm not sure if you're familiar with this story, there was a story of a young girl from Zimbabwe whose family is said to be actually suing the Charlotte Maxeke Hospital for what they say was their refusal to do a liver transplant, as she actually doesn't qualify. And maybe just Jeanette, from a government perspective, can also very quickly weigh in on this at the back of your answer, Professor.
So we have a national waiting list, and it's done on medical urgency and need. and it's different criteria for different organs, and all teams go through a multidisciplinary process to screen, because we know organs are such a scarce resource. And actually, it's not an acute emergency. It's a lifelong condition that goes into a team of specialists to follow it up. We had an excellent talk yesterday on pediatrics and adolescents, because to give a child a transplant and have them take the immunosuppression medication through those teenage years is its own unique challenges. It's always a motive. It's always a multidisciplinary team reviewing these cases, and we're in this as a collective, as a society, and we need to look at it that way. I don't know the details of the specific case. We have processes in place. If a foreign national to get a transplant, it has to be approved by the Minister of Health, but it also has to go through all those screening processes that are very rigorous and actually, unfortunately, very strict in order to get to that point of assessment. So we do have processes in place, and then we allocate as fairly as possible. So it's always going to the person with the best match and the most to gain from the situation. The trouble is there are so many people waiting with so much to gain that it can seem very, very harsh. But the benefits are there, and we're trying to do as best we can, but we can scale it up. If more people support donation, then these things happen much, much less frequently.
A very quick one, Janette.
Alicia, just quickly, yes, Prof. Thomson is spot on, and I'm also not going to speak to the specifics of this case because the transplant coordinators and the specific hospital is dealing with this case. But just to add that, remember, South Africans are first on the list. So before we give organs to people from outside of the country, we have to make sure that there are no South Africans who could benefit first. That's all for me, from me on this one, Alicia.
All right, Jeanette, thank you so much. Professor Thomson, thank you so much. Quite interesting. I mean, we're seeing with also the improvement in technology as well in terms of skin grafts for those burn victims. I mean, a lot can be achieved through tissue as well as organ donation. So, Jeanette and Professor Thomson, it's been a great pleasure. That is Janette Hunt, the Deputy DG for Primary Healthcare at the Department of Health, alongside transplant specialist Professor David Thomson.